have the, you know, information. Do we need to actually?
Or to do
I think you should, yeah. Okay.
Lillian,
As it is, we just won't take any.
Lillian, should I text Deidre? She was trying to rush and just say we don't have a, or should I have her rush to get here? Would that make a difference?
Well, if she's rushing, I probably wouldn't text her.
Well, she's with her director and.
So, yeah, we'll tell her not to worry about it.
Yeah, okay.
Okay, and I'll repeat what I just said, which is welcome to the October Davidson County meeting. We don't have a quorum, and so what we will do today, if there's just an agreement to not walk out on us, is go over some of the things that we had planned to do, push all the things that needed a quorum and a vote to the follow-on meetings, and then have a good fellowship with everyone and enjoy the day. So that was the welcome part. The announcements, I guess I do have one thing I wanted to go ahead, or I can wait, Commissioner, if you want to wait till you get there. I was gonna have some questions about whether the board has looked into a replacement for the physician, Dr. Williams, who left. So let me go ahead and say there's no public comment, right?
Nobody did public comment, no, sir.
And then, so that would put you there, because the other two items were to confirm the agendas.
Gotcha.
Have,
We've not discussed it. I'm sure as everybody knows, the big to-do's been about the sports complex and all this. So we've been hitting on that, and just a lot of zoning and stuff like that, but there's not come up anything about that replacement yet. So,
Well, we will need a replacement for the physician. So is it your best judgment or advice to Belinda and I to reach out to Debbie to ask her if that's
Yes.
something? Okay, so,
try to get that on the agenda for discussion.
yes, sir.
That'd be perfect.
Okay, that's what we will do.
Yes, ma'am.
All right.
was there anything else you had for us, sir, to bring to the board?
No, sir, not this time.
Thank you very much. All right, how much of the health director report did you want? to- Okay, then now we will go to the wonderful Lillian.
All right, thank you so much. We are going to roll through this quickly. Also, just, enjoy the time together, I guess. We do always a state of the agency when we talk about the health director's report. Some things to note: that we have a nutritionist position. We are recruiting for an advanced practice provider. We're recruiting for a social worker and 3 school nurses. Which that 3 school nurses is very difficult and challenging because those are schools that don't have nurses in them. So our nurses are spread incredibly thin right now. In the beginning of the school year, they're slammed with all the new students and trying to get everybody's care plans in place and try to make sure that all the students have what they need, make sure that they've got their IEPs and all that with the teachers, that everybody knows what's going on. They had to do all the training for the school staff personnel, and they are spread really thin. So we're thinking about that team right now as they try to navigate the challenges of a new school year with being short-staffed. Medicaid rate changes. Y'all may have noticed you got an email from me with a chart that talked about Medicaid rate changes. That is reflective of North Carolina's shortfall in the budget for Medicaid. So to sort of shore up and assure that services could be provided throughout the year, they took all of the services that are Medicaid reimbursable and they gave them an assignment of either a 3%, a 5%, or an 8% reduction in the reimbursement for that. What we found in Davidson County when we ran our last fiscal year, which thanks to Corinne and Tabitha, who got me those numbers, what we did is we looked at the last complete fiscal year of Medicaid services that were reimbursed. We applied the appropriate percentage by service, and we recognized that if we did the same amount of services for this fiscal year, we'd be in about a $40,000 deficit. The majority of that is in our care management program, which y'all may remember we are killing. And so we're already operating in the black in that program. So this is not going to impact our services in a way that will stop us from providing services. It of course makes us tighten our belts, but that's what the intention was and that's what we're doing. So we're in good shape, but no services will stop. No staff will be laid off because of this.
If that workload were to change, could that affect that?
Excuse me?
If the workload were to go up, could that affect that?
Sure. that number is based on service delivered. So for some, whatever reason, we had like a rush on our family planning or something like that, and we had more, then it would be more than 40,000 that we would see a reduction in what we were anticipating in our budget when we do the revenue type thing. But Corinne's keeping a close eye on that, as is Tabitha, and Tabitha's working really hard with our prepaid health plans and the private insurances that we bill for to make sure we're getting all the dollars that we can in Davidson County. So the federal shutdown, that has been a trip. That was effective October 1st. We have one program in our department that is a federally funded program, and that is WIC. It is 100% federally funded. As it stands right now, WIC is using formula rebates to carry them through 2 weeks. So we are still operating business as usual. Clients are going to the grocery stores. They're redeeming their issued benefits. They're coming in here. We're giving them the certifications that they need, and all that is rolling on. They've also heard that the USDA has found some contingency funds from last year, meaning WIC was under budget last year. And so the funds that they had left, they're going to try to reallocate to the states. And we're just kind of treading water right now as it goes for what is going on with the WIC program. We have been through federal shutdowns in the past. This, however, is the first federal shutdown that I have been the health director for that it looks like they don't have projections much further out with funding. The last big one, I think that we experienced in Davidson County that we actually had to furlough staff was 2009. I worked here then, but I was in environmental health, and I was like, where are my friends in WIC today? Why is nobody in the parking lot? And then I was told that they were furloughed, but it was a 3-day stint, and then they came back to work. So we're keeping a close eye on it. Michelle and I are getting on emails, we're getting calls, we're doing webinars and all the things just to try to stay on top of it. But right now we're doing business as usual in WIC. We are getting a new time and recruiting system, and let me tell you how fun that's going to be. Not at all. No fun. Progress has sometimes got growing pains, and this is one of those. We received word from the HR team that we are on a data freeze in Davidson County from October 17th until December 17th, right? December 10th.
Something around there.
Something. They were a little unsure of those dates. But what that means is we cannot promote, hire, transfer, change bank accounts, change our insurance benefits, or anything like that unless it's an absolute emergency during this time. So that's fun. A health department with a vacancy rate of 12.24%, we want to hire people and we will not be able to. So that's okay. We're working through it. We're doing what we need to do. But it is definitely not the best news. And then, of course, we'll have to learn a new software program, but progress is progress, y'all. And this is going to be a great improvement for the way that we do things here. Any employees that have applied for jobs in our current system, if for some reason, and we've got a plan at the health department, so I'm not worried about us. I'm looking at Corinne. She and Tabitha and I looked at everything. We've got everything worked out. But in other departments, if they don't get it worked out, if you don't either hire or close out a position, then you'll have to call those people back and say, hey, I know you applied for XYZ position. We have your application in Criterion. That's our old system, but you're going to need to reapply in the new system. And so that could be an issue because they won't transfer over. But like I said, don't you worry about us in the health department. We're good to go on that.
I may have missed. Did you have a time frame?
Yes, sir. So
I missed.
the new one, the new system, they hope to have online and going mid-December. We are supposed to start entering our time into it. It's a time and recruitment. On December 14th is when we start entering our time into that system. But in the meantime, emergency items can occur, but what they will essentially have to do is put them on paper, and then they'll have to go into the new system and hand data enter everything. So that's why they're doing a data freeze, because they're like, we just don't have the manpower to sit in there and data enter all day. So we're looking forward to that about 6 or 7 months into it once we work out all the kinks. But you know, like all things, growing pains at times. And then, as I said, we have a 12.24% vacancy rate, and the rate for the county is a little under 9. So that's not where we want to be. We want to be leading with being fully staffed. But hopefully we will get this turned around, especially after the new year when we have the new system in place. So we'll. They did say emergency positions were allowed to be filled during this time, and we're thinking that our school nurses and our advanced provider and our nutritionists are pretty emergency, but more importantly, the nurse and the school nurses, or the advanced practice provider and the school nurses are imperative. The schools are really struggling right now without having school nurses in the schools. So, the program reports, we had a surprise. Our number got pulled randomly for a CLIA, which is our lab inspection. So we got a phone call that said, hey, guess what? Lucky you, you've been pulled. The last one was 2009? Six. Thank you. I inverted the number. So it's been a minute since it happened. But of course, no surprise. Nailed it. No findings. No findings. They did a great job. So good job to Mary Lou and Angela and the entire team. We were really not excited to hear that we had been pulled for a random inspection, but thrilled at the outcome. OpenGov and WebGIS, like I said, those growing pains. OpenGov had some changes, but they were on the internal side, not the external side. Randy is keeping a close eye on it. They're making a list because we're going to meet back up with OpenGov in a couple weeks with all departments to talk about any issues that we've had. Stacy, of course, also will keep a list, but it's really more about the on-site program where the challenges are, where we're crossing over with building inspections and making sure that those things align. This change that is just been implemented has been at the beating of the drum of planning and inspections because they wanted what they called a parent thing. So like a parent-child relationship with jobs is, they call it a parent-child, but it's so things pass along together. So if you're doing a job at a property, other jobs that come in on that property remain attached and tethered like to their parent, which was that original one. And so they're thrilled to see this coming live with us, but now they're just trying to make sure it's working the way they wanted it to work. And WebGIS, in fact, Commissioner Kester, y'all got to hear about it from Jason Clodfelter where they needed some additional funding, I think, to get it done. But the WebGIS update should be really good for the county.
Yep.
It'll be a different way of looking at it. For those who do contracting work or are oftentimes looking at things like real estate, it'll be a different look, but it should be better. So we're looking forward to that. The county finance audit, that was fun. Not really. Michelle and Corinne worked very, very hard on that. It was a lot of paperwork. They ask for things. And the best way I can describe it is if you were to go to the grocery store, I guess, and pay with $100 bill, and that's how you always paid at the grocery store. You got your groceries, you paid with the $100 bill, and that's just what you do. When they do the audit, they would rather you have paid with $20 bills, have the serial number for the $20 bills, and the year that the $20 bill was printed for the 520s. I mean, right? It was work we had done, but it wasn't the way that we save it. It wasn't the way that we do it. And they want to see all these different things. So it is very, it's like, just,
I think I said multiple times, I don't really speak auditor,
here we
so
go.
is this what you need?
So we had all the stuff, but it wasn't saved and recorded in their formatting. Yeah. So that creates a lot of, we had to recreate things in the way that they wanted to see it because we had it, but it just wasn't their way. And so we're going to try to work with finance once all the dust has settled on this to see if they can provide us any tips because this is the second year that we've had to do this audit.
Yeah, and it's separate from, the state does its own audit for WIC, so this is at the county level with their contracted agency, but.
I guess it's almost impossible to figure out what format they want the data put into prior to the
They'll change it the following years.
changes.
Doesn't matter.
Anytime they want hundreds.
Sure.
Yeah.
As Corinne said, we have a state audit and the state audit, they want their things done their way. And so we're trying to sort of walk the tightrope of how do we answer to two different agencies, asking for the same thing, but wanting it in different formats.
Yeah.
So that has been fun, but we're done with it. They said they've got everything we need and we're just waiting for that final report. So Michelle and Corinne, great job with that. Festival season is here, which means, in Davidson County in October, it's barbecue festival. Stacy's already started going to meetings about that and trying to get everything ready. And then Jana's team with Health Promotions, she was telling us this morning in our staff meeting, they've got an event on Saturday and Sunday this week. So they're just running all over the town, trying to let everybody know about the things that we're doing at the Public Health Department. And that's by request. A lot of these folks are calling and saying, we'd really like you to be here. We're doing a community event. We'd like to see y'all represented. WIC is still operating with over 4,000 participants, and the rabid cat, that was not something that we like to deal with. We never like rabies, but a rabid, and that says rabbit instead of rabid. We apologize for that typo there.
And I thought there were two animals.
That is,
So that
yeah,
gotta be-
those
no.
crossovers. Yes, but a rabid cat was in the Southmont community, and thank goodness, this is like a near miss that we would describe. An individual who's pregnant, sorry, Corinne, we're gonna talk about pregnant ladies. We're gonna talk about these emotional pregnant women, and she had these beautiful little kittens in her backyard. She just had to feed them. I mean, they were babies and they needed to be fed, and they were so sweet. And this one just showed up and it had an injury, and she thought, oh, I feel real bad for it. I was feeding it too, and then it left, and then it came back, and when it came back, oh, good, it's back. Let's take you. And it was like, and it bit her. She said it didn't break the skin, but it did bite her. And so she called animal control. And thank goodness, this is where the near miss is with the Davidson County Sheriff's Office. They got animal control out there in time to catch the cat and find it. It went to the shelter, and our friends at the shelter said, this acts like the last rabid cat we saw. And so we tested it, and it was rabid. And so, rabid raccoons, I mean, if somebody gets bit by a raccoon or a fox, they're telling everybody, they're calling people. If you get scratched or bitten by a kitten, oftentimes you're not reporting that. So that's why rabid kittens and cats are so dangerous in the public health world, because people just think, oh, it was a cat, it scratched me, no big deal. So because of that, we sent out mailers to in a mile radius. We did, a press release and all the things, but we just want people to know, if you got in contact with a cat or you were handling a strange cat, it's likely that it could be infected with rabies if it scratched you or bit you. So that was not the most fun public health exercise, but we got it done and taken care of quickly. So kudos to our EPI team for managing that. And I think that was all that I had for that. It was, yes, sir.
Well, thank you very much.
You're welcome.
Always informative. Now, one of our items that we were gonna speak about, I guess since we do want the entire board's discussion on it, maybe we don't even bring it up now.
Yeah, I'll just skip
It
it.
sounds good. But anyway, that's something to think about. PhD letter that we talked about a couple months ago. If y'all have a chance to look over what we've already kind of put together for the next meeting. All right, and on some new business, we have employee awards.
Right. It says Hannah over here, but really, we're gonna turn this over to Stacy, but I wanted Hannah's name to get there. Hannah's down here, and Stacy's her supervisor, so I'm guessing Stacy will be happy to introduce Hannah and tell us why Hannah joined us today.
So obviously, this is Hannah Whitley at the end of the table over here, and she was nominated for the Rookie of the Year, and she won this year. So we're really excited. So go to the next slide, I can kind of explain. So to be nominated for the Rookie of the Year, you have to have the following on the other side. You can't be here less than a year, but not more than 3, have performed your regular duties as an environmental health specialist, and then went over and beyond. So Hannah Whitley's outstanding contributions and work has been recognized by receiving this honorary award. So she's pretty humble over there, but she does kind of hold our team together. She's always the first to volunteer to help staff on weekends for events. If they can't make it to do limited food, she's always the first to kind of be like, hey, I'll step in and help anywhere I can. Not only does she help us during the day and at nights, but she's also working to get her master's in public health at App. So she's constantly doing schoolwork also while she's not here. And just, overall leading our team with her work ethic and humbleness. And she's constantly thinking outside the box. She already is leading our team and teaching Surf Safe to the community. She helped use our grant to kind of help be cheaper for all of our restaurants to be able to come in and do that. She's went to a few of our classrooms. The food class, they asked her to come in. She kind of teaches like what we do. She went and had a whole course with the Lexington City School cafeteria workers. They were so appreciative of just having her over there. So we're just, excited to have Hannah on board and hope she stays a long time. But, she's been great to our program. So.
Congratulations.
I would just like to personal privilege, take a moment to say, as the health director, I sometimes get phone calls about, staff in the field, and everybody just loves Hannah. She's so sweet and nice when she comes in and does the inspections, and they just think she's great. And that's the kind of staff members that we like to have here. The regulator job is not easy. Nobody wants to be told what they're doing wrong in an inspection of a food service establishment, but Hannah does it very professionally, and people really do appreciate the work that she does. And I hate that Miss Yates isn't here, because aren't you her inspector over there?
Yes.
That's what I thought. So she's was unable to join us today, but Hannah really does a good job and makes this department look good. And so we're really proud of her, and but many, many congratulations for this award. So
Thank you.
you want to say a few things?
Yeah, sure. I really love what I do. Oh, thank you. That's so nice. I was talking about my interview earlier. I always knew I wanted, not always, I knew I wanted to do this job, and I'm grateful now that I'm in this position that I truly do love it. And I love working with the public, and I like feeling like I'm helping the community. So thank you guys.
Awesome when we get to share cool
That's
things like
right.
that.
All right, well, I guess we'll move on to what would have been the item B.
Yeah.
It still is, but
Yes.
and yeah, some debt.
This did require a vote. Oh, no.
Uh-uh.
Oh, great. Yay. All right, so bad debt write-off and debt set-off. We'll start with bad debt. Bad debt is anything that is less than $49.99 a year. If y'all approve, we can write that off, but if a patient comes back in, they will be notified of the bad debt and it'll be reactivated and reinstated so they can make a payment on it. So this year, as of last week or the week before, if you want to move to the next slide, we have none, again, because we're sending out statements regularly still. We are getting payments from patients as they come in. They're going through checkout like they're supposed to. So we're able to catch them before they actually leave. So the next one will be our debt set off. This is the accounts that have $50 or more with no account activity in the last 12 months. They must have a social security number attached to their account. No one under the age of 17 is sent to debt set off because technically they're a child, so it's not fair. The patient has been sent 3 statements, including the debt set off letter. After approval of these, if y'all approve, then I will send a statement with a letter stating that they will be sent to debt set off, and they have the option to make a payment within 30 days. If they don't do so by December, they will be sent to debt set off. And we go through each statement, make sure they're billed correctly, make sure the statements look good, and send them off. And we do that quarterly, so every 4 months. The total this year that we will be sending to collections is $406.11, which is only 2 accounts, but they've come through for certain services. Last year, we sent $264.71, and we have collected last fiscal year $1,976.29, and then the year before that was $1,883.88. The reason it's so low is because we are the last of the last to get anything. If they have an ambulance bill, it goes before us. If they have food stamps, it goes before us. If they have taxes, it goes before us. We are the very last person that gets anything. And that is all I have.
So typically we would do a motion for that and we can bump that to the next one, but because Tabitha had already prepared the slides, I just thought next time we could maybe just say, this is the debt set off. We would like to request approval for that. So we won't go through all the slides again, but we can do that.
I appreciate that very much because I was confident this time.
You did it so well, so.
I greatly appreciate that. I was ready today.
The debt set off, we're sending it to like a collection company?
Yes, we send it to a clearinghouse, and then once it goes to the clearinghouse and gets approved, they will send it out. And whenever somebody either wins the lottery and claims lottery, or if they file their taxes, and when our time comes up, then they'll take the money.
And does that cost the county anything or is, okay,
There's a program that's run by the states called North Carolina Debt Set Off.
okay.
And so government agencies can submit these debts, and then like if somebody has a tax refund, then that gets garnished.
And I never knew this, but some people file taxes twice a year. Never knew it until I started working here.
Never get mine done. I always have to have extension.
Exactly.
Well, thank you again.
Well, thank y'all.
So the next one was gonna need some input, but I did want to ask a question, Randy, if I can. Were we supposed to come up with some new ideas for the rabies clinic?
You're skipping over medication.
Oh, I did. Oh, I did. I'm sorry. So,
I mean, skip it. We can.
sorry. I didn't have any questions for you, so I want to.
Good.
All right, so this really, when I asked to have this put on the agenda, seemed a little bit more urgent, and then we got some more information. But I do still think it is relevant and something that we need to keep on our radar here in public health. Medication disposal, whether that be controlled substances, over-the-counter medication, just medications. So historically in Davidson County, I mean, probably early 2000s, we had 4 medication disposal sites across the county. One was at Thomasville Medical Center, one was at Davidson Medical Ministries in Thomasville, one in Davidson Medical Ministries in Lexington, and one was at what used to be Medical Park Pharmacy in Lexington. Out of those 4, the only one that is still there is Thomasville Medical Center. And these are the permanent places where you can take unwanted medications and dispose them, because we don't want people flushing them down the toilet. So CVS now has some corporate options, and they also have a medication disposal in Lexington and in Thomasville. Why not all of their Davidson County locations? I have no idea. Walgreens, they have them in all the surrounding counties, but not Davidson County. Why? We haven't gotten that far. But when this was brought to me by a community partner, they were only able to confirm Thomasville. And so we thought we had 1, if any, spots in the county where folks could take back medication. Because what we don't want is a lot of unused medication, especially controlled substances, sitting around. I mean, when I think about it, I know I've got, when I had my wisdom teeth taken out however many years ago, I mean, the medicine's probably still in the cabinet. So we want to get that off and out of people's homes. If you will go to the next slide, Lillian. So another thing that we used to also do here in Davidson County was Operation Medicine Drop. And what still happens nationally twice a year is the National Take Back. Operation Medicine Drop is kind of what the North Carolina initiative was, and it lined up with the Take Back Days. You can see I've got some numbers of what happened earlier this year across the state. I know they're really small, but you can see there were 38 sites in North Carolina that participated in April. I think the closest one to Davidson County that participated was over 100 miles away. So nobody close by is all, hosting these take back events. So I did started digging just so we could have a conversation or keep this on our radar about, is it, do we need to get back to doing these take back events? Do we need to look at getting additional drop locations across the county? and there's a lot of laws around that, which I'm sure y'all know. So the take back kiosk that they have now, that seems to be, it's what they have at Thomasville Medical Center. It's a little over $3,000. It has to either go in a law enforcement agency or a healthcare facility with a pharmacy. So technically, the health department could fall under that if we thought that was an avenue that we wanted to go. And they have, you know, the sharps proof boxes that go in them and liners. It comes with all the supplies you need, and you just package it up, print out a FedEx label, and send it off when it gets full. And it has some sort of monitoring sensor. And I think the supplies to keep those up run about $1,500, and it just depends on how often you're needing more supplies. Center Prevention Services out of Charlotte, but they do cover Davidson County, has looked and talked to partners about funding one in Davidson County, which a location would still need to be determined. But the take back events, that's also something that we would have to partner with law enforcement and a pharmacy, because that medication has to be destroyed and there has to be a plan in place for it to be destroyed. This is something we used to do with the pharmacy at Davidson Medical Ministries, now Contegra. I not heard if Contegra has any interest in, you know, getting involved in this again. We've heard a little bit about some other counties who have partnered with law enforcement and the animal shelter because they're able to destroy the medication at the animal shelter. But again, we're not having any active disposal events or a lot of options that are really close and that people can get to. If you want to go back to that first slide at the map, I mean, we all know how large Davidson County is, but I mean, the 3 locations where you can go to a drop box now don't even cover the majority of the county. So just some information to keep in mind as we go forward and look at public health issues.
Where do people find that information at? Something you think about in Google, I would.
But a lot of it used to, I mean, people would advertise, or we get a decent amount of folks who want to, you know, so-and-so's got this medication, or senior services might call, or somebody from the library might call and want to know where so-and-so, you know, can take their medication. And right now it is just these 3 locations. I pulled some old numbers. The event we did here in 2014, we had 175 pounds of medication we took back one day. I mean, it was crazy numbers. And they were able to kind of break it out by different kinds of medication, but it's something that you don't really want to float its way back out into the community if we can get it taken care of. So I just wanted to kind of talk through that, put a little bit of information out there. Again, when I brought this to Lillian, I thought we had 1, if 0, maybe 0 disposal spots in the county, but knowing that we do have some locations, and I think it's worth reaching out to our other corporate pharmacies like Walgreens, you know, can we get this in our other Davidson County locations?
We continue to discuss the opioid epidemic, and part of the opioid epidemic is starting with children who get a hold of medications that were not properly disposed of in homes. With the requirements that Jana has shared with it being attached to a pharmacy, that is a considerable hindrance to a lot of Davidson County that doesn't have reliable transportation to get to a pharmacy to drop something like this off easily. As Jana showed on the map here, you know, we could do one at the health department, but there's one at the CVS in Lexington, which if you're up for it, we could all walk there. It's not the shortest walk, but it's walkable. And so, you know, putting one here doesn't make a great deal of sense for accessibility. I would like to shout out to Dr. Brenda Bear, who's not here because he got a heads up on this as a dentist. And he said, I think CVS has them, because at that time we thought the only one was Thomasville Medical Center. So I wonder, and I don't know what sort of levers we have that we could pull with other pharmacies, like our private or our small business pharmacies, the Walgreens. why or how we could get them to get on board with this, but it is really expensive. I'll just say that.
For the pharmacies doing it.
Yeah, because
Okay.
to like send them off, and have all the things, that go along with it. And then it's also, if you're trying to get to the far reaching areas of Davidson County, looking at pharmacies really isn't gonna make or break you. As the health director, I get calls a lot, probably more than anybody else around here, like, my mother just died, we had hospice in the house, we have all these medications, what do we do with them? And so that's how we're sort of getting this information out, but I don't know if a good Google search would even pull this up for you, but we probably need to put something on our website where people can Google and say medication drop boxes.
There are, like, when I was doing my research here, there is a lot of returns for old outdated information. I mean, I think I found every drop location event that's ever happened in Davidson County, and it popped up like it was happening this week. So I'm not an IT guru, but working with IT to kind of see how we can archive some of those old things and get correct information floating out there.
The only thing that makes our location good is the visibility. Sure. That's why you get the phone calls, because someone
Right.
wants to know about it, but it does seem like that will be,
It
maybe.
started years ago with Project Lazarus, if y'all remember that. I don't know if y'all quite old in here. But that's where it started, and it started in the mountains because the mountain area was having a really hard time with overdose deaths. So then they brought it across the state, and we had a meeting here with the sheriff's department, years ago, and that's when Davidson Medical Ministries at the time took those 2 boxes, and that's why it says Project Lazarus on that box. And tried to place those, but the cost was so expensive then, but maybe it's come down since that was, but that's kind of where it started, and I think they're still up and running. I don't know who,
Those 2 boxes are gone.
no, I mean,
Oh.
the
Project Lazarus.
but I think it's not the same
Yeah.
focus, but it was all related to overdose deaths with the takebacks and things like that, so.
Jen, you said this was for Sharps also?
No.
Okay.
This
I knew you had
is
something about
for
that in there.
pills.
Just-
All of this is very specific, and it can't be any kind of creams or liquids or anything like that. It is for pills, period. And so there's a lot of, the new kiosks, that's what they call them on the websites. They're DEA approved, and I mean, you cannot get into them. And I think that was an issue and concern that a lot of folks had, several years back, as, are people gonna like try and steal it and, destroy my property? But the safety of them has come a long way, but it still has to be, in an area that is it's locked, that's either in a law enforcement agency or run by a law enforcement agency or connected with a pharmacy.
I wonder if we could use some of our opioid money. Spend $3,000 to get one of those boxes. I mean, we have a ton of opioid funds.
And that could be something that, because we don't have a quorum today, if y'all would like us to bring back, we could ask if we would like the Board of Health to make a motion that we request opioid funds. It's a good idea, Adam. And that would put it here. And again, to your point, the visibility of just the public health department solves all the problems. And so we would take medicine back. A lot of people think that we do have those answers for them, so.
Well, there's a lot of talk about stuff going in drinking water right now. A lot of things people don't understand. If it goes in the landfill, it goes back in your drinking water. So might be good to bring that up.
We can get some more solid information on exactly what it would cost to have one.
I've done.
And then sort of formulate a plan to bring to the Board of Health that y'all could modify or, edit. And then we could ask the opioid settlement committee if they would be willing to allocate funds to get it going.
It would surely be nice to have one in the northern part of the county, the very southern part of the county. States County is a long county.
Well, there's a CVS in Denton.
But they don't have it.
I know, I don't have one.
And I
I'm pretty sure they don't.
But if we could get the police department and, CVS and the private pharmacies, that would be something worth, having a conversation with them about as well.
And some of the little Walmart neighborhood markets have pharmacies.
I did check those too. The Walmart pharmacies were fewer in number, that had them. And I honestly could not find one in North Carolina that I could confirm. They did say that Walmart has the little disposal bags, so you can request those from a pharmacy, and sometimes we get those, and it's for 40 pills. But when you think about how much extra medication sometimes people have on hand, 40 pills, it's, just a drop in the bucket, so.
Thank you.
Yeah.
Now can I?
I can talk about rabies.
So anyway, sorry about that. Let me jump ahead, but, at first, did you want to put out anything? My question was, when we, reconvene, it's some other options you want the board to kind of ponder on some other options possibly that could save some money.
I mean, I think it's best to look at where we're spending our money and how we're spending our money. And then the effort that we put in from the result that we get back. I think that's the focus of where I was, I guess, moving this towards. I can run through it real quick, and if there's more questions, I think it's just pretty simple data that we collected for the past couple of years.
Yeah, if you don't mind, please.
Essentially, this is the general statute for rabies vaccination clinics. The short of it is that we're required to organize or assist at least one clinic per year. Here for the last 20 years, we have organized and held it as part of Davidson County. So we really haven't assisted anyone else. So it's been on our shoulders. It shows there the fee that we can charge. So we're limited. As far as I know, this hasn't changed in any amount of time. It's set at $10 for administering and storing, and then plus the actual cost of the vaccine. I can tell you 20 years ago, it was $5 a shot is what we got for it. This year, it was $14.25 is what the cost was going to be for a vaccine. We used some CD funding last year, and part of this year we were able to provide free vaccines that we actually reimbursed the veterinarian that was providing those for us. And that's basically what you're going to see in the data on the next slide. 2025, the middle column there is the health department's one clinic that we held. We did 215 vaccines that were free. So on a Saturday, you could come here, get a free rabies vaccine, a 1 year or a 3 year from the veterinarian. In a 3-hour window, we handed out 215 for free. The blue column there is the animal shelter for 2025, nearing 2,000. That's 365 days that year, however many days that the shelter was open, not 365, but.
That's to date from January 1st.
Yes.
So they will only increase.
Yes, and those are not all free, so those were paid for at low cost. Part of those were free that we provided. Don't know that exact number that we gave them. And then the last bar there is the certified rabies vaccinators that are appointed. There's 2 of those that I know of that are not associated with the shelter that essentially will travel around and provide low-cost rabies vaccines as well. And then flashing back 2024, we'll show you, we had 3 clinics there. Right around 500, I'll point out that one of those, we gave 65 vaccines. It was free. And so that's a long 3 hours to stand around and wait for 65 animals to come through. But basically, that's the data for the last 2 years. The math that Corinne and Lillian pulled together, it's about $4.20 a vaccine when you purchase it bulk. And essentially, it's about $850 to host a clinic here at the health department or wherever we choose. Some of the stuff that goes into that is, if we're not hosting it here at the health department, is finding a location where we can host it, having insurance and liability and getting approval to do that. That shows that we could get 225 free vaccines to the animal shelter if we chose to provide that, versus the $850 per staff that we pay in mileage and salary to do a clinic here. We could provide that to the animal shelter. And so then this is the questions, maybe what the board would recommend, what your all's thoughts were. moving forward, just look for some input to maybe change the way we've done things to be more successful or to help the community in a better way.
What does the partner with the shelter look like?
Well, like I said, this past year and the year before, we were able to provide free vaccine to them. And so they actually offered free vaccine. So some of those numbers that you see that they gave vaccine was free to the public. You could take your animal down there and get a free rabies vaccine. Moving forward, what does that look like? Maybe we provide vaccine for them for a 1-day free type thing, and then we can offer a staff or just the funding for that. So we don't necessarily have to host it, but we have to assist in organizing.
Okay, help fund it,
Yeah, promote it.
maybe vaccinators.
The vaccinators would be the shelter staff.
Okay,
That the CRV program that Randy was talking about, we have 2 community CRVs. North Carolina general statutes allow the public health director to name certified rabies vaccinators in the county, and then they have to take a test and they have to work under a veterinarian, and they can give a rabies vaccine that's good for 1 year. They cannot give a 3-year shot. In Davidson County, all the shelter workers that are willing to do it become CRVs, and they work under the veterinarian that the shelter has. And then we've got 2 folks that were pretty much beating down the door, and they were like, we're animal rights people. We go out to these houses and we build dog houses. We give horse food. We do food and all these things. And so they just volunteer their time. One of them's a PA, and so she has a medical background. She's like, I'd really like to be able to give rabies vaccines out there. And so they charge $7. They do home visits, and these are animals that will probably never go to the vet. Dr. Cope was the veterinarian at the time when we, on the board, when we made that decision to do the CRVs. He was a little bit hesitant about it. And most veterinarians are, because this means that maybe the pet wouldn't be coming to the shelter or to the veterinarian to receive normal care. But I've seen the animals that they go and help, and I don't think that they would go to the veterinarian with or without. So this is a way to help them slow the spread of rabies in the county. They also could be a part of it at the shelter if we wanted to, but to answer your question, really, that general statute says we have to promote and offer 1 a year. So if we could get the shelter to do it, it's their staff, they do it all the time. The 850, y'all know me, I'm super conservative with numbers. That was only 3 hours, and that was 50% of the people being at time and a half. Most of the people are at time and a half, so that already jumps us up on that 850 staff time that it costs us, and that's not salary and fringe, which is another number that goes in there. So it's kind of expensive for us to do it with our team. Back in the day, when Randy and I probably first started here, environmental health used to do this a lot, and I can remember being down in South Davidson County. It was like 150 degrees, and there were 400 and 500 pets that came through the line, and that makes sense. Let's all go out there, let's sweat, let's get it done. 65 does not make sense. And so with the CRV program that we have, that if people can't make it to the shelter, we can contact and give out those numbers, and they will go make home visits. They will go anywhere in Davidson County and visit people. So we have that option now, which makes this like traveling around to offer it to different people a little bit less important, in my opinion. And the shelter's doing so many already. It just seems to be a better use of our time.
So how many vaccines would you order, Andy? Like for a clinic, and what do you do with the leftover vaccines that you don't use?
So we didn't do any of that. We work with a vet that essentially he tells us how much he has to charge for the shots. It can't be more than $10 for administering and storing it, and then it's the actual cost. So it's me essentially, or Corinne, or whoever, Trey, talking to the vet, getting those actual numbers, getting documentation of what the shot actually cost, and then we don't charge anything. So it's essentially the vet that's getting the money for that.
So basically, taking people who are already covered up with work and adding a Saturday to them for 65 pets. Or we give the shelter, what'd you say, 225?
We could do even more than that. I mean, that was one. We have done 3 clinics in the past, so we have it built into our budget that we could do this in a way that would give even more free ones to the shelter if we wanted to do that.
Seems like a no-brainer to me.
That's what we thought, but we didn't know if our board members were like, oh my gosh, we love it. All of our friends use the Davidson County thing every year, and how dare you get rid of that? That's a service that the health department provides. So that's why we wanted y'all to get dollars and cents wise and headache wise. The hidden cost of Yeah, parentheses. The hidden cost of trying to get everything ironed out with the veterinarian and the location. We have to sign contracts when we go different places. There's a lot of things that go into it. If we could just say the shelter is doing it, no brainer. We are saving a ton of resources. But again, we didn't want to hurt any feelings where people were like, no, we really love this rabies clinic and we as the Board of Health feel like this is our duty. So we will bring this up again, but I'm not hearing from y'all that y'all feel that's our duty.
We got the one.
Yeah. So.
And I mean, we do, I mean, it's a 1 day last year, or this year we did 215 in a day. So I mean, that's
Sometimes it's good.
pretty good turnout, but that when it's 65, it makes for a really long day.
Nobody knows what to be ringing that day or.
We talked about that too.
Yeah.
You can't.
We had a near tornado one day and had to call it off. The vet can cancel it at the last minute. We actually, that's what we did the last clinic. We canceled it just due to the fact that we were concerned about numbers and turning out, being able to charging $14.10, which is low if you go to a vet's office to get a rabies shot. But when you're trying to reach the population that we feel like we're reaching a lot of times, I thought it was too much. And the vet did.
Still incurred the expense of everybody coming in and.
We didn't do that. Like I said, we canceled the last clinic.
We'll bring that one back up again, but now y'all have the information.
Yeah. Thank you, Randy. All right, speaking of vaccines, I guess we're moving on to human vaccine protocols.
Me.
Hey.
So I think what I'm supposed to talk about, I just learned right before I came in here. So the COVID vaccine protocols that we had no guidance on until I to this room, and I printed it out and I've looked at it while I'm sitting here. So I'm going to tell y'all a quick rundown of it. And there are really no changes in the recommendation when it comes to shared clinical decision-making. I don't know if y'all have been hearing about that, but the recommendation now is between the client and the provider. The provider can be a nurse, a doctor, physician, a nurse practitioner, PA, someone like that, but you have to have a shared clinical decision-making process to get the COVID shot. So it's not, the recommendation is no longer for criteria. They are still wanting the high-risk folks to get it, but the CDC director just signed yesterday. They sent this out and pushed it out right before I walked in. And it just says it's an individual-based decision for that person that's wanting it. And it's based on the shared clinical decision of risk benefits with the vaccine between the doctor, the nurse, the pharmacist, and that patient. That's the only guidance that we have right now. As far as guidance for the health department, we don't have any in our building now anyway, but we have gotten zero guidance as far as orders or things like that. So I will not be moving forward until I get that. So I wait on that. So it may take a little while, but that's where we will be doing the same thing. We have not had a lot of calls related to it and people requesting it. So I don't see a heavy participation in COVID vaccine for us. I just don't see it. We haven't had it right now. But it did say today for what's been given previously, the 24-25 vaccine, since he signed or she, I can't remember if it's a he or she, no vaccines until this new guidance is put into place. So it's going to take probably a week or so before we even get the final. So this was like hot off the press kind of stuff. So that's what we'll be doing here with our vaccine is they will have a shared clinical decision with the patient coming in and asking, not like broadly kinds of things going out.
I asked Mary Lou to bring this to y'all because there was a lot in the news about by prescription and things like that. And it was very different than what we had seen. Last year, your Davidson County Health Department was not the premier provider for COVID vaccines. We haven't been for a while. We have been encouraging folks. I mean, the spectrum of how things have changed with COVID-19 has been incredible, and we're not gonna go through the entire history lesson, but just to, it's fair to say, in the beginning, we were a provider. We then became, we're not your medical provider, and we're not everybody's in the hospital dying with COVID-19, so we're gonna ask that you reach out to your medical provider to talk to them. Then it became, the only people that really wanted them were people that were older and were on insurances that we didn't have contracts with. So we told them, you can come here and get it, but you're gonna have to pay the out-of-pocket price. So they went to their own medical providers, which is what we would kind of prefer anyway. So we are no longer the game of COVID-19 vaccines. And so I don't even know the last time we gave one. Do you?
No, we haven't had it.
I mean, it's been a very long time.
Haven't had it. I will say that we are required to be the safety net provider for those that want it and don't have any type of coverage, like insurance coverage. And that's for children. But other than that, that's it. But we don't see that either. I mean, I don't know when the last time we've seen that here. But yeah, you will hear a lot of different things, but as of October 6th, that is the new guidance. It will be a shared clinical decision-making between provider and patient for whoever is wanting the vaccine. Even your 65 and older population, I know that was big, and oh no, the 65 and older population, they can get it. They can get it, and they still say that, but they still want it to be a shared decision-making process. That's all I have for that.
All right, our last thing, do you have the,
So we don't have subcommittees really anymore. We didn't move forward with them because of the changes that we were gonna try to make to the bylaws. So there was no replacement. Dr. Williams was on it, he came off. We don't even have a physician. So it was my best professional judgment that we would not use that list because it wasn't up to date.
Okay.
But
I just couldn't remember.
historically, the
Wrong meeting.
leaders were the chair, the vice chair, the commissioner, for whatever reason, the physician, and then I think Justin Nifong participated last year.
Yeah, sure he did.
So here's the deal. We don't have a quorum today, but the health department's required to do annual evaluations, and that period is October 15th to December 15th. Our next meeting will be in December, and it will be the responsibility of this board during that meeting to have a closed session to provide to me my annual evaluation. It is the way that we do it here for new board members or board members that aren't aware, we do a 360 evaluation, which includes members of the board, everyone that directly reports to me, and peers within the county that I work closely with. Adam, you may have done it last year. I thought so. And then like the assistant county manager will participate, and then sometimes like another department head. And so I get feedback from everybody. Y'all receive the report. Corinne runs it all. She sends out the emails, and then y'all receive the report. You sit down as a board, you talk about it, and then you just provide me in closed session with an update on what needs to be done. As Dr. Ellington was saying, it had previously been an evaluation subcommittee, but because of the guidance we'd received and what Adam and I have talked about moving away from subcommittees, I thought, well, we'll just try to see how y'all want to do that this year. So I thought we might need a vote, but I don't know that do we need a vote for who would do my evaluation, or do you know? If we just said, you can send an email to Corinne, we could open it up to all board members if they're interested in participating, would that be okay? And then they could be a part of it without a vote?
The non-board members aren't voted on.
Correct, yeah.
So the board members who normally are part of the subcommittees are the only ones. And that was, am I right? That was only because of how they were assigned by the original subcommittees. So
Yeah, I mean,
something I don't know the answer to that.
yeah, I mean, I think the simple answer is, I mean, if the board as, or as the board, whatever its decision-making process is, will, prepare a, evaluation and, and give it to Lillian. I think that's, if we don't have some other delegated group within the Board of Health to do it, then I think it just, you would just be talking about, I think you would have an evaluation that the board would vote on, and say, well, we think this is, because everyone's gonna have, all the board members will have their input. I don't know in the past, when that committee would get together, would they just sort of reach a consensus on what would go in the evaluation?
The evaluation has always been the 360 print off. It's like
Okay.
40 pages.
So it's really just that. It's not you guys getting down and like boiling all the
Right.
feedback down into these are consensus on is this. It's more like you just get this big
Report.
Okay. Okay.
And then, what I have experienced as the recipient has been oftentimes, for example, Dater, I'll use you, not on the evaluation committee, but if Dater wanted to really say something about, well, like in the last year, Lillian dropped the ball at one meeting or Lillian excelled at another meeting, and I want to make sure that that is brought up. The board would talk about it, and then they would say to people who have participated in the evaluation, as well as all the other board members, do you have any input that you would like to have a discussion? Because when Lillian comes back, we're going to talk about it. The chair would just sort of take all that down, then we would sit down. And then what has happened in the past is the chair and the vice chair and I go to lunch, and then we talk about it some more, just about like how I can improve what I should be doing and just wins and losses for the year. I think because we don't have a quorum today, it may be best, and keep me legal here, is if we just say, maybe we just send it to everybody on the board. There is a cost with those who complete it. Do you remember the cost per?
We typically pay, I don't know that if we add more evaluators, that it would increase the cost.
Okay.
Each year has been $450 to complete it
Okay.
with your peers, your direct staff, and the subcommittee.
So if you're okay with it, we could just send it to all the board members, and if they choose to participate, then they would be included in those that I report to.
I'm okay with that. I was also wondering if we almost like send out a poll like we had before on who wants to. I can already tell you I do. I think it's a responsibility to do, and I'm sure Odin, Calvin would. And normally it's 4 anyway, correct, on the subcommittee.
I just want to see what a 40-page evaluation looks like.
Oh,
In 40 pages, that's what I get. They have this whole like.
that's what I try to look at before I talk with her.
It's definitely not the shortest thing, but what I get from it, it's like, it says, oh, your peers say that you excel in this, or your peers think that you could do this. So here's some tips. So it folds in tips for me to read through about how I could do better next year. Like this computer generated program tells me what I could do. So it's interesting. The thing that I'll be 100% transparent. Corinne and I have been trying to find a new tool because it is so long. But what's great about it is it's anonymous and it's 360. So if anybody that gets it, the people that report to me, y'all just want to slam me, I won't know who it is. And so that's what I really like about it, because I want people to be honest and give me the honest feedback. And this anonymous way to do it is a really great way to receive that feedback, in my opinion, which is why we have continued on with it, and just the importance of making sure that we're getting bi-directional communication on how I.
Record, I'm 100% against that.
About what?
Anonymous.
Really?
If you have something to say to somebody, you need to say it, and they need to know where it's coming from.
Not everybody's as nice as you, or as like willing to do that. Some people really want to tell somebody something, but don't want to tell them to their face.
Then they probably just need to shut up.
100%.
Well, I mean, there's that for sure.
I think if there's not a huge cost to it, yeah, I think maybe just send it to all the board
Okay.
members,
I can reach out to Greg Mayo and just.
just to make sure we're not like really cranking up some kind of cost of it. What are our hit times in? So it's gotta be.
It starts on
December.
October
Okay.
15th, and then usually when we send it out, we give you a couple weeks. And then what we will probably do as the chairman is send you the report, maybe you and Calvin, the vice chairman, and y'all can look at it. And then you will be responsible for directing the conversation with the full board in December in closed session.
And that closed session really is what we always just brought the subcommittees opinions and then just brought it up and talked about it a little bit. And then after that is when usually we get together. So, yeah, I like I said, long run, getting our feet into something super expensive.
Yeah.
We'll send them all.
But I don't think that would require a motion, so then we're good to go with that.
It was so synonymous, huh? I didn't know.
Yeah. I think the chairman might say boss.
It
So
does,
I
yeah.
think
I
that
don't think it
one would
works.
come through, but I think everybody else is, it's divided up into direct reports, peers, boss, and then evaluators. So you might be the boss, and then the other board members would be evaluators, and then it would be the peers, which are the county folks. Direct reports.
Well, yeah, like I said, it's always an easy one to evaluate when you have a good hard worker too, so. All right, anything else on that? I think it sounds like a good option. Okay, cool. Well, we don't have to have a motion to adjourn since we're technically not in the meeting, so.
All right.
Well, I was
Sorry,
I think you're doing a little, I mean,
Okay.
I think it's okay, if you all, if you talk about procedural things like you were just doing with the, with, who gets the evaluations, for example. So I mean, it's fine if you all, have a meeting and do informational stuff. So if you wanna, it probably makes sense to go ahead and, and adjourn, just.
And I guess we'll have an adjournment decision
By consensus.
by consensus. All right. Then, our next meeting at, there it is, December
Second.
2nd.
Well, I don't know. I put it right before I came here. Can we trust it? It's an idea. It's very just.
The rabbit.
I know you're pretty strong.
Has been.
I'm enjoying it.
Okay.
Our rules are silent, we can always refer back to.